So let me talk now about payment reform and what are the options. And hopefully you'll all feel like you've got at least a bachelor's degree in payment reform by the time I finish. Payment reform tries to move away from the pay-for-volume, fee-for-service model and to reward performance both in terms of efficiency and quality. There have been efforts underway in the United States for a number of years to try to move in this direction, I would say in a herky-jerky pattern. But right now, there is more attention to payment reform than there has ever been in my career. I can say that, by far. It's a very fertile time period. We need to make sure that we seize the day and make sure that payment reform is implemented well, because it's not the concept alone, but it's the execution that matters. So I'm going to walk you through a series of models. This arrow suggests that we're moving from worse to better or less intensive to more intensive. In fact, I don't want to place any value judgment on these options as I present them in front of you, but I am going to move through them. But don't think that the last one's better than the second one, for example. Their goal, though, for all of them is to reward high-quality, low-cost care. So let's do pay for performance first. Pay for performance has been around now for a couple of decades as a pretty common payment model. CMS defines it as a use of a payment method and other incentives to encourage quality improvement and patient-focused high-value care. There are many different forms that pay for performance takes. Most often, it's offering a financial bonus of some type to a provider for strong performance on a specific group of quality measures. It continues to use fee-for-service as the underlying payment mechanism. So pros and cons here is the pros. We begin to create a business case for something other than doing more. And usually a business case for quality, although there are some pay-for-performance programs that also have incentives for efficiency. And there are some reviews in the literature that suggest that pay-for-performance can have a positive impact on quality. The downside, the evidence of clinical effectiveness is mixed, and there's not really strong evidence of cost savings at all. In order for pay-for-performance to work, you have to have real careful attention to design, and a lot of pay-for-performance programs have not been well designed, and so they haven't realized benefits. I would say the biggest con to pay for performance is it does not neutralize the inflationary forces of fee-for-service payment. Why might that be? Anybody?
Well, you're still getting, if you're monitoring diabetes care, it still requires more office visits and more testing, and so you're paying for more procedures.
Yeah, although theoretically, if you're getting better diabetes care, then that patient whose diabetes is well managed then won't need to be hospitalized. So that could be, but theoretically you might have some gains. The biggest problem with pay for performance is as it's instituted, usually the size of the financial incentive has been 2, 3, 4, 5%. So if you're a provider and you're weighing your financial incentives, fee for service, more volume, more revenue, and maybe a 3% bonus, that incentive bonus just isn't big enough to change your underlying business incentive.
I agree. The National Business Group on Health promoted the Bridge Project 8 years ago. It's the most successful diabetes wellness initiative for 110 employer groups, and it was exactly what you're talking about. It was the bonus for fee-for-service was so low that the employer group said, best for us to take the Asheville project, figure out what really worked this time, and then work in a medical neighborhood model, which is today the ACC, and do exactly what you're talking about. And my hope in healthcare reform is we'll see a lot more of what Medica and Fairview started 5 years ago. I hope that we'll see the benefit of it. My biggest concern about where we're going in healthcare is, you talked about a shortage of primary care physicians. My biggest concern is, do some of the models make that even worse, because it really talks about If I want to survive in a capitated environment, I have to now start acquiring other small clinics around me.
Okay, so we'll talk about that later when I get further along my arrow. There's a hand up here.
How much does the delay of any of these payment systems go into that? I mean, you don't know, you do this work and then you're not going to get the payment, they're going to analyze and it's going to be 6 months, 9 months before you get that bonus, as small as it is. I mean, how does that fit in?
Yeah, so there's a lot of research on incentive models, incentive theory, and the later the reward is, the less powerful it is. One of our problems in healthcare is it's hard to give timely rewards because we can't assess performance until time has passed and claims have been paid. So usually we're giving our rewards way after the action that had to be taken. That's the challenge. So I want to move on. I'm not going to say that pay for performance is without merit. There are both pros and cons here. I'm going to identify both pros and cons for all of these models. And I would say in general, I want to emphasize that the model's important, but the execution of the model is just, if not more important. So you talked about Bridges to Excellence. Bridges to Excellence is a pay-for-performance program that actually did have some success on the quality front in Minnesota. The action group implemented it in 2006, 1,100 private and public purchasers, 900,000 covered lives related to diabetes care, vascular care, and depression. The goal was to improve quality and increase consumer and purchaser awareness and make providers compete based on quality. The results are pretty good. 400% improvement on diabetes score in 5 years. Other care for vascular care and depression also improved. So it can work, and it worked for you. I don't know whether it reduced your costs, but at least on the quality front, these were pretty impressive improvements.